Namaskar. This is Dr. Alok Roy here again from Medica, Kolkata. Like every week, we are here again with a webinar on health is the ultimate wealth. And today's our topic is gut health. Health for digestive system. You know, today, when you talk to the people, the drawing room conversation invariably spills down to the diet. And most of us are going back to our roots. We are avoiding wheat, we are eating gluten, and we are eating various kinds of materials put together in chapati. The standard food which we are taking for last 30, 40 years is changing very fast. Now, I met one doctor. He's a doctor, very well-known doctor. I don't want to name him. He was telling me, Doc, I was Alok, I was having diabetes, and I stopped taking wheat and milk, and my diabetes has disappeared. I've lost a bit of weight, but I'm no more diabetic. Now, it's far from truth, but the very fact that avoiding wheat and gluten and milk must have given some kind of relief to him. And today, the gut, the intestine, are probably the central point for the health. And how do we deal with it? What is it all about? In Bengal, the digestive is probably health is paramount in the mind of all of us. Today I have with me Dr. Pradeepta Kumar Sethy. He's our Director of Gastroenterology, a very experienced gastroenterologist. And he has a lot of insight into what is the way to keep your gut healthy. With this, I hand over to Dr. Sethy to take you further on today's topic, digestive health or gut health. Pradeepta, over to you.
Thank you, sir. Namaste. Thank you, sir, for your kind introduction. Once again, I welcome you all for this health initiative by our chairman, sir. Today, I will discuss gut and health, that is gastrointestinal diseases and our health. I will oversimplify certain medical terms and health diseases for better understanding. At the beginning, I bring warm greetings from Gastro team, our consultants, Dr. Devnath, Dr. Samanta, our registrars, Dr. Supinder, Dr. Saurabh, our nursing staff, technicians, coordinator, Mr. Sampath. So today's agenda: dyspepsia, gas symptoms, which is very common. Second is GERD, which is known as GERD, gastrointestinal reflux diseases. Irritable bowel syndrome, commonly known as IBS. In Bengal, it is called colitis. Diarrhea, constipation, and as I told you regarding milk intolerance and wheat intolerance, which is quite common number of patients with these four symptoms. Then finally, I'll talk regarding GI bleed, patient presenting with black stool, that is bleeding from the rectum. So what is digestive system? We all know digestive system starts with mouth, ends with rectum, through the esophagus, stomach, and intestine. It also includes liver, gallbladder, and pancreas, which makes digestive juices and enzymes for the digestion. What does the digestive system do? What is the role of digestive system? We all know that turns your food into nutrients and gives energy what you need for survival. Also, it packages your solid waste for the disposal when you have bowel movement. Now coming to the gas symptom. almost 60 to 70% patients, they present with some type of gas symptom. That is medically we call it dyspepsia. They present with barfing, passing excess gas, pain or cramps or knotted feeling in the abdomen, bloating, which are very common. Why dyspepsia? Why there is a gas in the stomach? We all know gas in the upper part of the stomach is primarily because of the swallowing. Whenever you eat something or drink something, you unknowingly swallow some air. And gas in the large intestine, that is colon, that is because of the bacteria is ferments the food residue which is not digested in the intestine and forms gas. Whether gas symptom is normal? Yes, some amount of gas, that is 200 ml of gas in the digestive system is normal. That is part of the normal process of digestion. And getting rid of excessive gas either by burping or passing flatus is also normal. Most commonly, an increase in gas pain may result from the eating foods that are more likely to produce gas. So some food can produce more gas and that should be avoided. Now, this is the most important slide. You have, all of us have some gas symptom at some stage of someday. When you should see a doctor, there are certain alarm symptoms. Like if you pass blood in the stool, recently there is a change in the stool frequency or consistency, or you are losing weight, or you are having severe pain rather than gas symptom, or you feel a lump in the abdomen, lump in the tummy, then you should see a doctor. When should you take an immediate care? Sometimes you have some gas symptom at some day of some day. If this is prolonged, like the pain is persistent, one should rule out pancreatitis, ulcer pain, gallbladder stone. Then you should need an emergency care. You should visit an emergency room. Also, some of the gas pain, they have some chest pain component. One should do an ECG or echocardiography and see a cardiologist. So many times we miss a diagnosis of cardiac event during the gas symptom. Now, how to manage? First of all is healthy food, avoid smoking and alcohol, and take low-fat diet. Stress is an important aspect of life, but we all know stress increases gas symptom. So one should get treatment for the anxiety and depression if you have. Whenever you have alarm symptom, as I told you, see a doctor. Sometimes endoscopy is required to diagnose any ulcer, be it cancerous or non-cancerous. And one should avoid over-the-counter medicines, that is antacids, some type of PPI for prolonged period. If you are recurring for a prolonged period, then you should suspect something else is happening inside the tummy. This is an important message. I see many patients, they attribute everything to their gas symptom. So please don't attribute everything, whatever is happening to your body, to your gas symptom. Even gas symptoms and other major illness like cardiac illness, malignancy, they can coexist. In fact, GI tract, that is your intestine, stomach, is a great sympathizer. If you have any illness, if you have headache, you have body pain, you have fever, you have some nausea, vomiting, some type of GI symptom. So you have to be careful about other major illness in addition to your stomach complaints. Now coming to GERD, whenever there is a stomach acid or stomach content reflux back to the food pipe, we call it GERD. It's very common. Mild acid reflux occurs almost twice a week. And Some moderate to severe acid reflux can occur once a week. Now coming to GERD symptoms, what are the common signs and symptoms? The burning sensation in the chest, commonly known as heartburn, usually after eating, and which can be more worse in the night. Chest pain, difficulty in swallowing because of the esophageal ulceration, regurgitation of the food or soury liquid to the mouth, and most commonly, most of patients feel something in the throat, some lump, some odd feeling in the throat, that are because of the reflux. So what are the risk factors for reflux? Hiatus hernia is a common risk factor. One can be diagnosed in the imaging or on endoscopy. Basically, there is a hernia, there is a defect in the food pipe and stomach junction. Obesity is one of the most common risk factor. If you are obese, then there is more chance of acid reflux. Lifestyle measures like smoking, alcohol can cause more reflux, and certain medicines like beta blocker, some food items like coffee, chocolates, that can increase your reflux. Now coming to GERD, if you have reflux, what should you do? The most important is lifestyle measures. Change your lifestyle. Take a good diet. Cut down your citrus food. Cut down your fatty food. Stop smoking. Stop alcohol intake and lose weight. And certain medications can try, that is antacids, PPIs, prokinetics we commonly give. But in some patients, they have very bad quality of life because of reflux. In them, we do some type of endoscopic therapy to tighten the food pipe and stomach junction. Even a surgery can be done to get rid of severe GERD symptom. Now, what is an endoscopy? We are all scared of endoscopy, but this is a very simple procedure. Can be done on sedation, but most commonly it is done a local anesthesia spray. Basically, endoscopy is a procedure when a flexible tube is introduced to see the intestinal tract, that is stomach and food pipe and duodenum, mainly to help us diagnose certain conditions like any bleeding, any ulcer, or any obstruction. Now, next topic is irritable bowel syndrome, that is IBS. Second common, I told you, this is called colitis, commonly known as colitis in Bengal, and there are abnormal contractions in the intestines, so you can feel it. Some patients are very sensitive, they feel their intestinal movements, so they have symptoms. Now, few points regarding IBS. This is a very common disorder, but not life-threatening. This can hamper your quality of life, but cannot kill you. And this affects most of the intestinal tract. The sign symptoms are mainly pain abdomen, diarrhea, constipation, or a mixture of all these three. We all know this is a chronic condition that requires lifelong management and it can relapse. So these are the symptoms of IBS: constipation, cramps, diarrhea, or feeling of incomplete bowel evacuation. So once you pass stool, you feel like going to toilet again. You are not satisfied. So these are the symptoms, and you can have mixture of these symptoms or alternate of the symptoms. So why IBS? Why this happens? So this is because of the muscle contraction of the intestine. We all know intestine is like a tube. If this contracts, we have pain or you have diarrhea. If there is less contraction, we have constipation. There is a role of nervous system plays in IBS. And we all know when you have an acute diarrhea, loose motion, that is followed by a IBS symptom. And many times I've seen those who have early life stress that can have implication IBS symptom in the later life. And recently, there are lots of studies regarding change in gut microbes. We all know we have bacteria, plenty of bacteria in the healthy bacteria in the intestine. If there is a change in the bacteria population, then you can have either diarrhea or constipation depending on the type of bacteria and amount of bacteria. So there are certain triggers. You all know, like you're fine, and there are certain triggers like some food or some stress triggers the event, and you have more loose motion or constipation. So how to diagnose IBS? This is a diagnosis of exclusion. That means we need to do some investigations to exclude other life-threatening illness to have a label of irritable bowel syndrome. So most of time we do something like colonoscopy, endoscopy, some blood test, and rule out any major illness like ulcerative colitis, malignancy, and label as IBS. So what is a colonoscopy? Colonoscopy is a procedure when you introduce a tube from the rectum to see the whole large intestine. This requires some preparation to clean the colon, and mostly it is done under sedation. So once you do it in sedation, it's almost painless and very like take a couple of minutes to complete the procedure. Now, what are the type of IBS? As I told you regarding constipation, diarrhea, and mixed pattern, and certain patients they have very not specific pattern like either mixture of constipation, diarrhea, or in addition to some pain. So this is stool chart. You can see type of stools 1, 2, 3, 4, 5, 6, 7. Type 3 and type 4 are normal. This chart is used by most of the doctors to know the type of stool patient is passing. So many times the patient tells in different way. So this is a consistent way to take the history whether patient is having normal stool or hard stool or diarrhea. Now coming to diarrhea, mainly there are two groups of diarrhea patients, like acute diarrhea, when the diarrhea symptom is less than a month, and chronic diarrhea when the symptoms are persisting for more than a month. Acute diarrhea events are basically from food poisoning. Either you are traveling from the Western countries to India or some third world countries, that's called traveler's diarrhea, stomach flu. Chronic diarrhea is because of commonly either it's irritable bowel or celiac disease, some type of food allergy. Uncommonly, you can have IBD, that's inflammatory bowel disease, or tuberculosis or some other illness to cause chronic diarrhea. How do we define diarrhea? This is basically loose, watery stool, possibly more frequent bowel movements. Depending on the cause and duration of diarrhea, we treat. And in acute diarrhea, hydration is the most important part. To prevent infected diarrhea, and one should emphasize hand washing, start taking healthy and fresh food, take enough water. When to visit hospital? All of us have some episode of diarrhea in between, and if the diarrhea persists beyond 2 days with no improvement in the stool frequency and consistency, or you become dehydrated, you have some abdominal or rectal pain which is severe enough for taking any medicine, or you have bloody or black stools, you have fever above 102, then one must visit hospital for the treatment. And diet in acute diarrhea is very common question. Still, mother's advice the best for the diet in treating diarrhea. But I will tell you, during the episode, take lactose-free, low-fiber diet, mostly boiled potatoes, plain white rice, and some fruits with less pulp. Now coming to constipation, which is very common, almost 15 to 40% of the population they suffer from constipation. Before discussing further, once we start treatment of constipation, we know the etiology of constipation. Most of the constipation patients can be cured. How do we define as a doctor what is constipation? The condition in which we have fewer than 3 bowel movements per week. That means if you are passing stool not every day, then it can be normal also. Stools that are hard or dry or lumpy. If there is the stool passing is difficult and painful, or feeling that you are not passing the stool and you are not, there is incomplete bowel evacuation. What to do when you have constipation? Change your diet, take more fibers, drink more waters, be more active, do some exercise. Start taking laxatives, commonly isabols. And if you are not improving, then we need to investigate further, maybe starting with some blood test, do a colonoscopy to rule out any obstruction. Many times we do a manometer study, basically to look for any motility problem. That is, your colon is not propelling the stool properly. There are certain specific medicines to increase your colon movements. Even in difficult cases, we do something called biofeedback, which is like a physiotherapy in treating the constipation, or sometimes very rarely you can do a surgery for the constipation also. Now coming to the little bit uncommon disease, but for a gastroenterologist is very common. It's called inflammatory bowel disease. The two illnesses, that is Crohn's disease and ulcerative colitis, that are characterized by chronic inflammation of the GI tract. So this whole of the intestine will find multiple ulcers all over the intestine. There will be thickening, there will be stricture, there will be some leak, fistulas in the intestine, and both these conditions are autoimmune disease, that it happens of its own. So why IBD? Why inflammatory bowel disease? The baseline is there is a defective immune system, and with that many factors are added like genetic susceptibility, change in gut microbiota, change in gut bacteria, and many more factors including stress, hygiene, physical activity, your sleep pattern. Most of the IBD patients, they have persistent diarrhea, pain abdomen, weight loss, fatigue, but most commonly, almost more than 90% have some type of rectal bleeding or blood mixed stools. How to diagnose IBD? Commonly, we do two type of investigation, like endoscopy, colonoscopy, and some type of imaging, including MRI and CT scan. What should you know regarding IBD? It's a lifelong disease like diabetes or hypertension. Disease can improve or deteriorate during the course of illness, even with treatment. The severity varies from person to person, and we have multiple treatment options starting from some couple of tablets to high-end biological medicines, which is very costly. So depending on the disease severity, we start the medicine. Now come to lactose intolerance. We diagnose lactose intolerance when you are not able to digest the sugar, that is the lactose in the milk. As a result, they have diarrhea, gas, bloating after eating or drinking mainly milk and milk products except curd. So in this case, you have less enzyme, that is lactase enzyme, which is responsible for the illness. So how to treat? So I'll emphasize one point. If you have lactose intolerance, still you can digest up to 100 to 150 ml of milk per day in different forms. And in market, lactase enzyme is available, which can be taken just before the milk intake or after the milk intake to digest the milk component. Now coming to gluten intolerance, it's very common, it's fairly common concern, and mainly there's a adverse reaction to the gluten, which is a protein found in the wheat, barley, and rye. We have three illnesses like celiac disease, non-celiac gluten hypersensitivity, and wheat allergy in gluten allergy patients. So out of these, celiac disease is a genetic condition and is more severest form. In case of gluten intolerance, you will find bloating, diarrhea or constipation, pain abdomen, fatigue, headache after taking gluten products like wheat or wheat products. And some patients, they even complain of brain fog. That is, there is a confusion, some disturbance in the thinking process after taking the gluten products. So the difference between celiac disease and wheat intolerance, these are both can produce similar symptoms, but gluten sensitivity, they don't have any abnormal gene or antibodies, and this is a less severe form than celiac disease. So how to treat this condition? There is no cure for gluten intolerance, but in most of the patients, we have to stop the gluten products to get a relief from the symptom. Now the final couple of slides on GI bleed, that is melena or bleeding from the rectum. Whenever somebody passes black or tarry stool or fresh blood in the stool, that is a medical emergency. So symptoms can occur from the blood loss, from the GI tract, and a common source of GI bleed, that is ulcer bleed, cancer bleed, or many conditions in the upper GI tract and lower GI tract. What to do in case of GI bleed? In case of GI bleed, one must see a doctor. If required, should be hospitalized. Initially, you start with medical management, including a couple of medicines and blood transfusion. At present time, most of the GI bleed can be managed with endoscopy or colonoscopy up to 95% success rate. Very like in 5% patients, we need to do a surgery if bleeding is not stopped with endoscopy management. I'll just summarize a couple of tests in gastroenterology, common test. Some blood test, regarding LFT, lipase amylase. Some stool test. One stool test which is not common is called fecal calprotectin. This is basically for the inflammatory bowel disease. Lots of endoscopy procedures. Breath test, that is hydrogen breath test to look for any pectoral overgrowth. Radiological test like CT scan, MRI, and manometry. Manometry mainly meant for the to check the motility of the GI system. The road to health is paved with good intestines. With this comment, I'll thank all of you for a patient hearing. Over to you, sir.
Thank you, Dr. Sethi. I think you have very, very well enumerated, but a lot of questions need to be answered. I fully agree with you that the road to the health is paved with good intestine. Now, what is the best way of keeping intestine healthy?
Yeah. So to start to answer this question, I have a couple of times comment.
Can you please take out your slide?
Yeah. So basically, good diet and
just take off your slides.
Yeah.
Yeah. So what is good diet?
Good diet, sir. Mainly, sir, we have to, for different conditions, like for GERD, we stop citrus food. And fat is bad for the course intestine and liver. Low citrus food, low fat, and exercise. Diet is in 70% of Indian population, they are milk intolerant. So you will have some symptoms after taking milk. So if you notice some symptom after taking milk, you have to stop or modify your diet or cut down your milk intake. But fortunately, in western part, in northern part of country, we see more of celiac disease, gluten hypersensitivity, but we don't see much gluten problem in Calcutta. Maybe you are not taking lots of wheat products here, but it's very common in the Western countries and Delhi, Punjab, this area of country. So
I have
milk,
few very
gluten,
basic questions,
yeah,
Dr.
sure.
Sethi, that what is a good way of eating? There are now, somebody says that eat every 2 hours. Someone says have a breakfast of a king and lunch of a prince and dinner of a pauper. What is the best way of eating?
Yeah, still, sir, this comment is holds true. What I feel, what the studies show, and this comment holds true, but the frequency should be, many times, sir, you have seen some ulcer patients, they come back and tell me, doctor told me to take every 2 hours diet, and they put on weight. So that is not a solution. You have to take three major diets, 1 or 2 snacks. 2 snacks
So three
and
major
3 major
meals
diets.
are, the three major meals are prescribed, and
Lunch,
as you said that
breakfast and dinner.
yeah. What about intermittent fasting? Latest fad, 16 hours. They don't eat from 8 o'clock till 2 o'clock.
Initially, we are not advising, but lately, because of the obesity and there are many studies to prove that intermittent fasting is good for health, and if you can do it carefully and in a planned way, is definitely will be helpful.
So those who have intermittent fasting, how do they manage their nutrients intake?
So somebody is doing intermittent fasting is mainly for a maximum 1 day, not more than that. But and for a drastic
No, intermittent fasting means they are fasting for 16 hours every day, 365 days a year.
no, sir. Maybe once a week, once a 10 days, once a month.
No, Dr. Sethi. The latest fad is to have 16 hours fasting for 3 months.
And that will be maybe I don't know, and I'm not gone through this literature, but this will be difficult. Your system will be totally different, and we know that the amount of weight loss or amount of this should be controlled. We expect maybe not more than 500 gram weight loss per week. Anything like if you're drastically losing weight, that is also bad. We have seen even this liver decompensation, liver issues, and gallbladder stones. They come very fast if you lose weight and you do a drastic crash diet.
So somehow you're not convinced that 16-hour fasting.
I'm not convinced, sir. And this should be, yes, I agree, but this should be in a planned way, not every day.
Okay, all right. So, Dr. Sethi, what you said, a lot of things you talked about. You said that shouldn't take, when we were on the gas, to start, we started with the gas and said we should take food which will not create gas. So which are the food which creates gas other than milk and gluten?
Yeah, so there are some mostly this like dal-like things. They will cause more gas-like thing. Those food which are not digested in intestine and stomach, they go to the large intestine. They are basically starch, some type of starch, and sometimes those complex sugars which are not digested in intestine. They cause more gas formation because they reach their colon and the bacteria has a time to ferment it. At the same time, what we see commonly, those patients, they eat in hurry, they don't chew properly, they see TV or do something and eat in a hurry. That time they swallow lots of air. That
but half the population feeds their children watching TV.
Yes, that we have seen the gas in the stomach, the gas in the upper part is mainly because of the swallowed air. And many patients you have also noticed, many patients come to the OPD, they feel there is some pain in the back or pain somewhere, and they press it, they bump out some gas. So that can't happen. This is scientifically not possible. What they do during the pinching, they swallow some air. and take out the same air. So that is very common with this type of patients.
So you mean to say that if I'm getting it correctly from you, what you are saying, that the food is very individualistic. Some people digest the same food, some people don't digest the same food. So every individual has to figure out which food gives him gas, which are the food which can give him a gas, and you should avoid that. And also you said, if I heard you correctly, that when you are eating food, don't get distracted. Focus on the food. Chew it properly. If the food is chewed properly, then it creates less gas and get digested better. Is that right?
Yes. And we have seen also, sir, if you're taking some type of diet for many years and you change your diet, then you have different type of symptom. So change in diet, you expect some type of symptom, and you have to tackle that.
So when you change your diet pattern, there will be some changes in your bowel habits. So you have to tighten yourself accordingly. Is that what you're saying?
Yes, sir.
Correct. Now, next question was gastroesophageal reflux. You said very clearly that gastroesophageal reflux means when the acid comes to your heart, chest, and there's a burning in your chest, and you need to have probably it's caused by the obesity. You said smoking, alcohol, and coffee. You said these are the four main culprit which gives you the gastroesophageal reflux. What about the, suppose my personal experience has been, whenever now I don't eat that much, but when I used to eat a lot before sleeping and don't give enough gap between the food and the sleep, there will be more reflux in the night.
Yes, sir. So in addition to what we advise the patients, whenever you eat something, don't lie down, move around a little bit, at least for half an hour, move around, and then only go lie down. Because we all know there is no tight valve in the junction of food pipe and stomach. So whenever you eat something, that can come back also. Which we know during the sleep time, there's a relaxation of all body muscles, even the G junction also. So you expect some type of reflux also.
So the as you said in the beginning, that breakfast of a king, the lunch of a prince, and dinner of a pauper is the best way, because then you won't get reflux in the night. Of course, smoking is smoking is bad in gas. You also said that IBS, irritable bowel syndrome. You said nobody dies of it, so don't worry too much about it. Is that right?
Yes, but sir, believe me, there are patients, even they don't die, but they are really have troublesome symptom. People change their job, people change their workplace, people change the place, and they have so much of like hamper in the quality of life. So somehow quality of life matters, but they don't die.
Yeah. So no, what I understood from your Dr. Sethi, you said that emotional stress is the primary reason for IBS, and IBS further precipitates the emotional stress, isn't it? So it's a cause and it's effect both. So, and you also, if I remember, you said that those in the early period of their life who had a more emotional stress, later on they got more irritable bowel syndrome. Is that true?
Yes, sir.
So if I heard correctly, what you said, that those who are emotionally stressed in the early part of life get a symptom later in life, but it doesn't kill. It worsens the symptoms if you are constantly stressed by it. And you said that a certain kind of food triggers it. You said that food and stress triggers it, and you said that it present in three forms: pain, diarrhea, constipation. So whichever category you are in. Then you also said that Dr. Sethi, that there are abnormal, where there's a celiac disease and there is a gluten intolerance. These two are the one which gives you IBS, which is a worse form, isn't it?
Yes, sir.
Good.
So I'll just emphasize, in case of IBS patients, if you see any prescription of IBS patients, many times we find some medicines for the anxiety and depression also. They are very scared. Why, doctor, you have prescribed me some medicine which is causing sleep, which is causing some symptom? But this is a part of treatment, because we know there is something called brain gut axis. If you are in stress, your brain is in stress or in depressed, then your bowel movement changes. You are depressed, you have constipation, you are anxious, you have loose motions. So you have to somehow correct from all angles, from the diet, from the stress factor, from the medical side. So we have to treat in a wholesome.
Dr. Sethi, another question I have, that the gas symptoms, chest pain because of gas, chest pain because of gastroesophageal reflux, chest pain because of kind of problem. How do you differentiate with the heart problem?
Yes, but sometimes very clinically very difficult to distinguish from cardiac issue. Recently in the media also there is a coverage, somebody had gas symptom and ended up in cardiac event and died. So what comes to our mind, this is very like misleading, because these patients have cardiac event but presentation was like gas symptom. So many times, depending on the severity, the response to the medicine like antacid, then you should go ahead with an ECG at least, or some cardiac enzymes. But this is a prime time. You should not lose the time. Sometimes you go on treating the gas symptom and are losing the patient of cardiac event.
So you
And
are saying that whatever may be the cause, if you have a chest symptoms, get ECG done. Especially if you are in that age group. If you are young, 10, 15 years, don't bother. But if you are in that age group, get ECG done. That's your advice.
yes.
Correct. Doc, what you said was very, very heartening. You said about lactose intolerance. You said those who are intolerant to milk can consume 100 to 150 ml of milk in different forms a day. So,
Yes.
So it's not that you have to stop drinking milk, but reduce the quantity, bring it down to a level where you do not have a symptom because of that. Is that what you said?
Yes, sir. We have done studies in India. People have digested up to 1 glass of milk per day. That is milk and paneer or some other items, and they are not symptomatic. So, but what I believe, there are some patients who are really symptomatic. They don't tolerate. Then, if they love to take milk, then you have to give some type of enzyme, which is still now available in India also.
Very nice. And you also said, which is, I mean, we'll conclude with that. You said that constipation is fully curable. And
Yes.
you said that don't worry about constipation, just find out the reason for it. Is it
Yes.
because of, and you have to try it out first with the diet. Second, active lifestyle. Third, take some laxative, exercise. If I heard you correctly, you said that
Yes.
diet, change your diet. If you are getting constipated, get into a diet which is a fiber. You give a picture of carrot and leaf and spinach and fibers and vegetables. Once you change your diet, once you become very active, and once you take laxative, you become okay. If not, then you have to find out why. And you said that you will do colonoscopy and all that. You show the picture. So those are the ways of keeping your gut healthy. Is that what you said, Dr. Sethi?
Yes, sir.
Good. So you all would agree that Dr. Sethi did a great job of explaining to us about various commonest symptoms, gas symptoms. That he said that irritable bowel syndrome, GRD, gastroesophageal reflux, diarrhea, constipation, lactose intolerance, that IBS because of the Crohn's disease and celiac disease, the wheat intolerance, and all it leads to a couple of very common things. He said: have a good diet, have a good sleep, have a normal life, be stress-free, and live a life where you eat less in the night, more in the morning, you'll be healthy. All intermittent fasting of 16 hours a day for years together doesn't help anybody. To plan to lose your weight in slowly and systematically, continuously, rather than losing it all of a sudden. So with this, I think I would thank Dr. Sethi, all of you who are listening to us, and every week you join us. Thank you very much, Bengal Chamber of Commerce and Industries, Rotary Club of Calcutta, Vienna, for being our stakeholders, taking our messages to the people. We will record it and send it to you and bring it to you, and you can share with your friends and your relatives and your people with you who matter to you, and we do it because we believe health is the ultimate wealth. If you are healthy, you are the happiest person around. Next week, we are talking about the spine problems and low backache. We are talking about what is the structural changes which can happen in a spine and which can give you low backache and how to prevent it. I will have Dr. Ellen Tripathi, who is our vice chairman, who will come himself to talk about spine and the low backache. So please stay connected with us. Join us every week, every Saturday, 5:30, 6:30. We bring it for your good health. Have a nice weekend. Thank you. Namaskar.
Thank you, sir. Thank you very much.
Thank you.